Kurt Fowler and his wife, Trina, were celebrating their 18th wedding anniversary at a country music festival when the shooting started. Fowler, 41, knew he'd been hit in the ankle and couldn't run. He hid under the stage until the gunfire ended. "I knew my foot was completely useless," said Fowler, a firefighter from Lake Havasu City, Arizona, and a father of 3. He underwent surgery, spent nearly 2 weeks in the hospital, and still may need another operation. He also will need rehabilitation and follow-up visits with a specialist. Fowler has a Blue Cross Blue Shield (PPO) through his job, but he said he doesn't know how much he will have to pay out of his own pocket for the care he is receiving. In an era of higher deductibles and limited choice of in-network doctors, however, he knows he could face significant medical bills. His insurance card says his individual deductible is $5,000 and his co-insurance 20%. He said he didn't know how much his health plan would cover for out-of-state care. Las Vegas shooting healthcare 3. "It's a mountain that just doesn't seem climbable," said shooting victim Kurt Fowler of his medical bills. "Medical expenses are astronomical these days," Fowler said from his bed at Sunrise Hospital and Medical Center in Las Vegas. "It's a mountain that just doesn't seem like it's gonna be climbable, but we are gonna do our best." As hundreds of survivors struggle to recover emotionally and physically from the October 1 attack, they are beginning to come to terms with the financial toll of the violence perpetrated against them. Even those who are insured could face untold costs in a city they were only visiting. "The total costs of medical care alone could reach into the tens of millions of dollars," said Garen Wintemute, who researches gun violence at the University of California, Davis. "And that is just the beginning. Many survivors will be out of work for months, if they are able to return at all. We really don't have a good handle on the intangible costs of something like this, the ripple effects on family and friends and neighborhoods, when a large number of people have been shot," Wintemute said. More than 100,000 people are shot every year in the U.S., according to the Centers for Disease Control and Prevention. That generates about $2.8 billion per year in emergency room and inpatient charges alone, according to our recent study in Health Affairs. The average emergency room bill for an individual gunshot victim is $5,254, and the average inpatient charge is $95,887, according to the study. Related, patients pay the price when hospital giants hire your private practitioner. The U.S. Senators representing Nevada, Dean Heller and Catherine Cortez Masto, wrote a letter to America's Health Insurance Plans, an industry trade group, and Scott Sirota, CEO of the Blue Cross Blue Shield Association, requesting help with out-of-network bills, co-payments and deductibles for the Las Vegas shooting victims. Many of the people who were shot had traveled from other states, including California, Iowa, and Tennessee. California and some states protect consumers from such bills, but Nevada is not one of them, said Sabrina Collette, a research professor at Georgetown University's Center on Health Insurance Reforms. But Collette said most insurers allow patients to request exceptions based on the circumstances. In this situation, I imagine most insurers are going to want to be compassionate and work something out, she said. The victims and their families aren't the only ones who will be affected financially by the mass shooting. Taxpayers too pick up much of the tab for the healthcare costs associated with gun violence, because many patients are covered by Medicaid and Medicare, two government insurance programs. Related, Zappos offers to help cover funeral costs of every Las Vegas shooting victim. And hospitals will also be on the hook for some of the care for patients who don't have insurance. Hospitals in Las Vegas quickly mobilized to treat the hundreds of victims who were streaming in that night, and they don't know yet how much of the care will be reimbursed. At Sunrise Hospital and Medical Center, staff treated more than 200 patients. Sunrise plans to file insurance claims, and will be extremely sensitive to the financial status of patients when considering their out-of-pocket portions, a spokeswoman said. Las Vegas shooting healthcare too. GoFundMe accounts, like this one for Tina Frost, have been helping victims and their families get by. Valley Hospital Medical Center is encouraging patients to complete paperwork for a state program called Nevada Victims of Violent Crime, which would pay their balances. And Dignity Health Street. Rose Dominican said it will bill insurers and accept donations, but will not require payment from victims. California victims can also get help with medical expenses and income loss from the California Victim Compensation Board. In addition, a GoFundMe account started by CL